everybody. I am Dr. Pushpa Sathish Kumar, Senior General Surgeon at Gallstones Hospital. I would like to tell you about some of the common surgical problems. One of them is hernia. Hernia is nothing but it's a bulge which comes onto the abdomen or onto the groin areas. These are because the area is weak, the muscles have gone weak, which could be because of like people who lift heavy weights or who strain because of say constipation or who have chronic cough. Also it happens in people who have undergone some abdominal surgeries in the past because the area where the surgery was done, the incision, the scar has gone weak. So whenever patient strains and then the intestine or the fat around the intestine, what we say as omentum, starts to come out and it appears as a bulge. So initially it doesn't cause any much problem, but later it starts producing pain. Sometimes the intestine which is bulging out can get stuck and the blood supply of it can get compromised. So such people should always take a surgical advice and it has to be treated at any cost. Otherwise patient can have complications. So how do we treat? We can treat as open surgery or by a laparoscopic surgery. So in laparoscopic surgery, usually it is a minimal invasive procedure where a scar the incision which we take is usually a very small one, and we try to reduce all these contents back into the abdominal cavity and we reinforce the area which is weak by putting in a mesh. The mesh is nothing but it is just like a net-like material which is made of synthetic material which is polypropylene. So this helps to strengthen the area, and we advise the patients not to lift heavy weight for next 2 to 3 months time. So this is one of the very common problems. Another surgical problem which we come across is gallbladder stones. Such people usually will have upper abdominal pain, they can have nausea and vomiting as well. These stones usually form in females who are in the reproductive age group, who are little on the obese side, and these are said to be because of probably a change in the metabolism which leads to change in the concentration of the bile in the gallbladder, which could be because of hormonal influence. These gallstones can sometimes remain silent whole of the life, but sometimes can produce symptoms. So it can be mild symptoms, as I said, can be an upper abdominal pain, could be nausea and vomiting. Sometimes they can get complicated. Presence of stone in the gallbladder, such patients getting a very high chance of infection in the gallbladder, which we say as acute calculus cholecystitis, or it can get even complicated when a stone slips into the common bile duct and patient ends up having jaundice or other complications like pancreatitis. So it is advisable that such people always undergo surgery. The surgery what we do nowadays, which is the gold standard, is the laparoscopic surgery, where it's 1 centimeter 2 small incisions and 2 small holes, where we remove the whole of gallbladder along with the stone. So I would advise you that whoever have these surgical problems, please visit our Gallstones Hospital. We have all the expertise and all the facilities to give you the best of the treatment available. Thank you.